grandmother looked after the smallest kids together. So they all time saw their grandmother like this, early morning to evening, because their mother outside, they don't see mother, father, they live grandmother together. They are all habitual cluster, habitual.
Wow. Wow.
So you're saying children will copy mother and father. They copy the adults. Dr. Aise Cemile, thank you for joining me on this JawCast episode. It's a pleasure to have you. I'm so impressed with the results I've been seeing from your MSE and face mask cases online on Instagram, and it's my honor to be able to have you on this podcast.
Thank you very much. It's my honor to meet you too.
Wow, look at that diastema. So it looks like you're also now in MSE treatment. Is that correct?
Yeah, of course. I love MSE. I love result of MSE, really, yes.
So you were getting such good results with MSE that you decided to have one yourself?
Yes, of course.
And why are you doing MSE? For breathing or?
Why? Okay, sorry. Just only to breathe through my nose easily, because, I haven't much concern about getting more beautiful. Of course, my upper jaw was narrow, and my tongue a bit hard to fix and rest up position on palate. So, yes, to get a widen the palate and breathe through my nose. My first aim was this, yes.
Yes, good. And have you started noticing improvements in your breathing already? Because your diastema is very big.
No, not much. For me, it's totally 8 millimeter. I stopped it after turning 45 turns. Yeah, it's approximately 8 millimeter. Not much.
Okay, and this is all you're going to expand? You stopped expanding?
Yeah, I was a hard case because approximately 1.5 year ago, I tried myself an MSE without CBCT mapping, because there isn't enough technical support around me. So I measure myself and put MSE is, without CBCT. So it failed. And when I checked with program Real Guide to mapping MSE, frame of MSE, to get the better result, we saw that I haven't enough bone support on my palate. So I was really, really hard case, even though when the patient coming me with my palate the same, I say, no, we can't do MSE. But I said for myself, if this MSE doesn't work, I am ready to do left surgery, corticotomy, because it was really essential for me to breathe through my nose. And I believe that with mini-screw assisted, even SARPE, surgical expansion, will work on me.
So when you did the second MSE, what did you do for surgical assist? Did you do a cortical puncture?
Yeah, midline. When I examine my suture, I recognize that in midline there is fusion, conjunction with the two bone. So with my surgeon friend help, we did punctures in anterior here area,
You did punctures like here?
Yeah.
Did you do
Here.
Did you do any punctures here?
No, when we look, because I haven't any bone there, so it was already released, it was already not dense. It seems to separate easily, yeah.
Wow. And so what surgical assists do you use on your patients if they have a hard time splitting?
You mean
Do you use
dome?
Do you use like dome? Do you use cortical puncture? Do you use piezo electric?
Yeah, we use piezo, but I don't do this. I prefer to surgeon perform it. I only perform cortical puncture because it should be it's easy compared to dome cutting the sides, buttressing side. It's a bit hard, bleeding happening, and it should be after do stir, it's hard surgery, so I prefer not to do for myself. But I perform cortical puncture as Von Moon, Professor Von Moon, last year, April, in Paris. He described how to perform this, not like opening flap with surgery, without surgery. He very well described how to perform it, so I do it easily on my patient in the clinic, chair side.
Right, and so can you describe that procedure? What does that involve? That surgical assist that Juan Moon taught you. How is that?
Only the midline punctures, He said insert on one point and feel with the mapping of CBCT, feel the stir and touch on the cortical line of, cortical, the up near your line is very hard one. When you do punctures there, after it will be split easily then. Do you understand what I mean?
Yes, I understand. Wow. And let me ask you, so it sounds like you have a plan for helping people split, because it's hard sometimes for people to split. What about for asymmetry? Have you seen a lot of cases that have asymmetry, and how do you deal with it?
I think for me, really it's hard to manage it, and there isn't much option to correct, because I am the asymmetric face, still my eyes, my occipital bone up, all my skull I know, because my physiotherapist says, and I do nothing for me, or just MSE only expand it laterally, okay? Axial force it happens, and some doctors says it can be managed with changing elastics, using with Facemask, one side maybe one, the other side twice. I advise my patient, but the asymmetry, I mean when the one side is more back than the other, but sometimes one other side is more low, the other high. I think it's very hard to manage it. Do you understand what I mean? Asymmetry is different.
Right. And so do you have to monitor your patients like once a week, once every 2 weeks, to make sure that the asymmetry doesn't get so bad?
Yeah, it's important. So I warn them, please send me regular photos of your profile, both sides. For example, I have 8 side of profile photos, front and right or left side. And I also want them to get intraoral teeth photo, all side together. All week I compare what's happening from their regular photos, and I manage the treatment with using, I said, use your elastics. For example, you have seams asymmetry, so use this side much more elastic, for example, 3 here for 5 here. And I also ask my patient, listen your feelings, because you should feel pressure on your zygomas, cheekbones area, that it's really coming forward, and you should manage the force. I can't exactly say you how elastic you should use. You should understand how much you use it. So I let the patient to manage their treatment, because I know that it's changed person to person, the forces, you know. It's I said keep the force optimal, you know, that you can stay for a long time with the same forces. I don't want it's hard for your TMG or makes you headache, you know, because we want regular forces to get upper jaw more forward. It doesn't come suddenly, so we don't need really much force. We want regular and optimal forces. I have really good cases, face mask.
Yes. Do you put face mask hooks on every MSE that you do?
Yeah. Normally, some patient doesn't need really big, but I put, maybe we change our idea maybe, so I put yes, like that.
Yeah.
Me too, I have.
Oh yeah. And are you using face mask?
No, I am very bad patient. Yeah, but when I saw my patient good result, maybe but really face mask using is very hard and long time needed. For example, I have patient using 1 year, so with MSE, I can't believe sometimes MSE is still on the palate and never loosen the tats, you know, mini implants never loosen and stay there, and they keep face mask and they love face mask and say me, please doctor, please let us use a bit more time. So really they have, if they let me, I put Instagram when they let me, but they don't let me, some patients. So I have really a couple good cases with face mask. Maybe I plan to measure with CBCT. I guess they have really 3 millimeter or maybe more than 3 millimeter coming forward on their face. It's so apparent.
Did you say 10 millimeters?
I can't say because we should measure it with CBCT, but I will take.
Approximately though?
10 millimeter, no, it's not realistic for me, because even with the surgery, they can't do much. It relapse. If do much, the muscle get it back, so relapse happening. Maybe 5 is optimal with surgery,
5.
you know, 8 or 5 with surgery. So if the face mask pulling, if 3 millimeter, yes, it's very good. And there is research with the adolescents, you know, 12 or 15 years old kids using face mask, and really they get forward growth with MARPE, you know, mini implant assisted expansion after adolescence. So 15 years old boy or girl, the same coming forward. There is a case study in the literature, scientific search shows they get 3 millimeter and relapse happening 1 millimeter or a few less.
Wow, that's very impressive. For an adult like me, I'm 32 years old, an adult male, to get, let's say, 2 or 3 millimeter with face mask and MSE, how many months or years do I need to wear face mask, and how many hours every day to wear it?
In my experience with my patient, approximately 6 months to 1 year needs to use it regularly to see apparently change. But you know, I haven't enough CBCT comparing, because normally I want CBCT in the initial, after end of the treatment. I can't say on my patient, yeah, just only checking. I want to send you X-ray because it's not ethic for me.
Yeah.
But
Yeah.
apparently, and they also pleasure for the results. So from the result, 1 year is very good. And the 12-hour, I advise them to use in the beginning of expansion because the bone is very loosened, so there is a good advantage, you have good chance to give a really good forces. So I advise them to use at least 20 hours all day as you can. After they decreases it to 12 to 10 hours a day.
Which face mask do you use? Do you use the one that goes here to here?
Yeah, this is a simple
Or
one.
do you use the one?
I tried Netgear and I tried Dr. Sandra Hans appliance in my kid and for myself too, and some patient. It's like you are a robot. You can't. It's very hard to move. Maybe if you stay regularly watching TV or writing something, 1 hour, 2 hour. But sleeping with it, it's uncomfortable. The simple is very useful.
But don't you worry about pushing the mandible back?
With that face mask?
I worried and I warned my patient for this. If you have a pain, don't use it or stop using or decrease elastics. But generally they manage it, and I don't hear from my patient, oh, I can't do it. If patient really needs much forward growth, they do. I don't know how they manage, but I advise them, if you feel pain, stop it and relax, and after try. But the patient which take physical treatment, craniosacral therapy for TMG, they really manage this procedure very easily.
Why do you think MSE helps face mask? Is it because can you explain how MSE loosens the bones so that face mask can pull forward?
It's easy because there's tools here, expansion means the midline stur splitted. So when it's splitted, the hair, the other stur loosen. But it's not all time the stur with zygomas, here. Sometimes loosen coming from here, the conjunction with frontal bone. Anyway, if you be gentle and you push a loosened bone, it comes forward.
Very simple.
Yeah. The kids same.
Do you use face mask on patients who are not class 3 or only on patients that are class 3?
I said patient, you have a chance with MSE MARPE, you have a chance to get forward growth on your mid face. This also, of course, MSE itself open the airway, but when you pull your mid face more forward, your airway on the back will relax too. So this is, and aesthetically, of course, it gives you very good result.
Right. So for a patient, this is going to be difficult to explain, but I will try. I talk to a lot of patients when they bite. They have class 1 like this, but they say, I'm more comfortable when I bite like this if I relax my lower jaw like this. They say it's more comfortable to relax the lower jaw and let the lower jaw bite forward. But then they have no bite anymore. So would you use face mask for a patient like that, so that instead of being like this, they can maybe come like this. Does that make sense?
You mean that normally the patient is class 1?
Yes.
You mean? But they say I relax when I pull my lower jaw forward, so I relax. My position is relaxing. Okay. I had a male patient like this, especially said to me, I want to be bite like this. Please correct my bite. So I put him on my Instagram. Maybe you can see. I first get upright front teeth and see how relaxed it, okay? I don't let the bite to turn class 3. You know, I am also orthodontist, practicing in orthodontic cases for 12 years. So I manage the bite as I understand his concern, because he was like downward jaws and more back to his airway. His concern was I can't breathe easily. My nose open, but I can't breathe. When I do like this, I relax. So I manage the treatment first, opening out upper jaw, front teeth, tilting, Normally last was like this, so I let it come upright.
And so for a patient like that, instead of just moving the teeth, would you consider using face mask instead of moving the teeth on the top?
Face mask not push teeth. You mean? What do you mean?
So you said that you'll use. How do you move the teeth like this, with an expander?
Oh, it's orthodontic forces. Yeah. Sometimes I use Invisalign and coils. Opening coils, orthodontic coils. Yeah.
Right. So instead of moving the teeth, could that patient instead use face mask to move his whole jaw forward?
Of course. After I started MSE and give face mask, expansion rule is this: when the suture split, the front teeth is, as you see, your teeth come like this, going backward. Because by the time front teeth coming back to close the gap itself. This patient, I use also mini implants here to hang the teeth up and with the coils open to relax his bite.
Wow, you're very creative. So just to confirm, face mask is not only for people who have class 3. Anyone can use face mask.
Yeah, sure. Yes. Class 2 also need, yes.
Class 2 also. And sometimes class 1, if the patient says the lower jaw is more comfortable forward, even though, they can bite like this, class 1, but they're more comfortable with the lower jaw forward, they would be a candidate for face mask with you.
Yes, of course.
Okay, I understand. Because many people say face mask is only for class 3.
No. They can't. I think they don't know how to manage lower jaw then, because they think that if the upper jaw come more forward, first the patient is class 2, and the face mask, of course, push forward. So what will happen to lower jaw? It's after maybe fixed with surgery. So, but I manage the class 2 patient mostly with TMG splints, so change their bite in the new way, so lower jaw come more forward.
Right. Let me ask you, what did you do before MSE? Were you using tooth-borne expanders in adults?
Yeah, I use much, really.
Like, did you use like this before MSE?
No, this is mobile appliance.
Never.
I took education from Mike Mir for bioblocks and stage 1, stage 2. Yeah, hybrid appliance but I never used, even like me, did an appliance for myself. The movable appliance, I didn't prefer to use adult patient, but child and adolescents, yeah, I tried, but really hard. For me, Invisalign, clear alignment is more easy to manage teeth.
Yeah.
So do you use MSE on children too, or for children do you use something like this?
I use hybrid JawHacks, you know. Use only 2 mini implants. It is more easy. Sometimes I prefer to use tats, you know, Dr. Mariana Evans appliance with acrylic pads. I try, but it's sometimes hard to manage the wound happening on the palate. I generally prefer under 16 years old, 12 years old. I prefer 10 years old. I have patient, class 3 patient, male gender. I use mini implant assisted expansion.
Wow.
10 years
Wow.
old, yes.
Do you know about like DNA, AGA, ALF, HomeoBlock? Do you know about these appliances?
No, sorry.
Oh, yeah.
I heard from the patient, but I didn't use before.
Yeah, because, well, you're better off, because basically what they do is they push teeth. So you don't like appliances like that? Is that right?
If I use it, clear alignment is more comfortable for me and the patient too. If the main focus is tilting teeth, clear alignment is the easy way. You can choose which teeth to where to move. But with braces, you know, fixed braces, it's a bit impossible because you should all teeth braces put with arc wire, and you can't manage the forces. Arc wire give the shape, but with clear alignment, you can choose which teeth you want to move. So the AGA may be the same, pushing teeth, this teeth after this. Use Invisalign, it's the same if you want. Yeah.
Well, the difference is that the dentists who make AGA, ALF, DNA, HomeoBlock, they say it's not moving teeth. They say it's moving bone. They say it's expanding the suture.
No. No, it's not realistic.
No.
Yeah, you know, maybe if small forces, no, it's not. By the time the kids, you know, growing up to new teeth coming, for example, canine teeth, sometimes coming from the supraposition. So you manage it to getting down and expand the arc. By the time, yeah, when you keep following patient, you can see the arc shape is regular and not tipping teeth. But you understand that tongue posture is important, noise breathing is important, but it takes time. It's not can happen in the few months. Okay, these appliances with ALF or the other appliances that gives force, not measurable force, you know, extra forces. This means so if you keep giving forces all month, you make the teeth tipping, you know. The body biological answer is not same. It's more slow. I mean, it should be so slowly.
I understand completely. Do you think that extractions are necessary sometimes to take premolars and remove them? Sometimes? Or do you think with MSE you can always fix crowding without extractions?
I don't want to speak big because, before the learn about orthotropics, so it was 2017, I was practicing orthodontics, so I did extraction. But now I try to expand the jaws, not to extract teeth, of course. But, for example, I have some cases, like really patient couldn't manage to close lips, because the arc really more come forward. But it's not mean really maxillary forward. The alveolar part of the bone is really forward. So patient couldn't manage the closed lips. So for example, I have a recently new case. I did MSE. She used Facemask, and now I managed the treatment to getting molar teeth backward with clear aligner. I don't do extraction, but I give forces to molar teeth sequentially, not all of them, and push backward instead to extraction, But totally, I want to manage to lip incompetence. I want patient close lips easily. The extraction same. When you extract it, you get the front teeth back, get the back teeth front. So, because this patient now breathe easily throat noise, posture is good, but can't close lips easily. Do you understand?
Yes.
I don't extract,
So that seems...
I put back.
I'm sorry, can you say that one more time?
I don't extract, but I push back. I try to push back.
Right. Do you think that MSE can help some patients save their wisdom teeth, or do you think wisdom teeth always need to be extracted in most patients?
After teenagers after 18 years old, I think it's hard, because I have some cases, I followed them, a few cases. For example, she was my patient from 10 years old. When she come to 16 years old, came to me and say, I feel pain in my back, maybe new teeth, wisdom teeth coming. So I get X-ray, and I saw her lower wisdom teeth is writing like, not upright. It's coming like tilted. So I said to her, you should keep your tongue up posture, because when she was 10 years old, I give her an androgen activator, functional applings she used for getting lower jaw come forward. So I advised her to push tongue up posture and breath throat noise, like, mewing. I advised her, and she really listened to me. And after 1 year later, I get a new X-ray, and we saw that teeth more uprighted and find the space. Now she is 21, and the teeth come erupted on the one. Maybe if I found the vexibicity, maybe I can put Instagram. Yes, she was a good example. I have the same patient. When I catch them 16 or more earlier, we can change the wisdom teeth direction. But after that, it's very hard for me.
So, for adults who have wisdom teeth coming in side to side, if they have no pain, can they keep the teeth like that? Or should they get them removed even before there's pain or infection or anything like that?
Yeah, of course, if there isn't any risk, a profession, a doctor should, really experimental doctor should comment on it for me, because some wisdom teeth should be extracted but sometimes they can stay there, and if you clean it easily, if you manage it, yeah, no problem. I have some patients say, not it's erupted, but this direction, it's good, because I believe that when they extract it, the bite can change. I have some patient complained about this issue, says, when I extract my wisdom teeth, my class 1 came to class 3, for example. And I have another male patient, 36 years old, I guess. He said, when I extracted my wisdom teeth, my lower jaw went more back. It's very strange. I understand what they mean, because, their tongue, their myofascial, orofacial feelings change. For example, the patient said to me, when I put a nut on the gap, extracted area, I feel more comfortable. My tongue feels more comfortable. Do you understand what he says? Because before extraction, tongue feel more up position. Now he says, I feel the gaps of my tongue coming more lower and feel this area. I can't keep my tongue up position anymore. It's very strange, but it happens.
Is it because, doctor, the wisdom teeth, they're so big, like they're like this big, and when you take them, it's like taking out a stone that's holding the wall, and then the wall falls back? Is that how it is?
Yeah, I believe it's related. It's so strange. Wisdom teeth really causes some side effects. For example, one patient came to me, said, my audience in air, acoustic change, so I can't travel with plane. I hear so much voice in my ear after extraction of my upper wisdom teeth. So strange.
Wow. Yes. Speaking of that, do you think MSE can cause ringing in ears if the expansion is too much? Can it have an effect on the ears?
I think can possible, because me too, I get ear infection. Never in my childhood, I never get ear infection, and the first time in my life, I get infection on my middle ear. And I went to ENT doctor, looked my nose, it's open, there isn't, because I normally have congestion on my nostril inside. But it was so clear, only the sinus is coming there and affected my air. I think maybe expansion caused, but I am so happy the result, really happy, because I am breathing through my nose. So I use antibiotics and it passed now. It's okay. Maybe
Yes.
maybe I should say, before the infection started, the pain started, I did a ship, ferry boat trip. In the ferry boat, inside the pressure, air pressure changed, so I feel uncomfortable. Started there, maybe if affected air pressure, maybe affected this infection.
Right. Yeah, that could be, because I think, like, when you go on boats, the medicine they give you to stop seasickness, they call it Dramamine, and I think the way that works is it affects the liquid in your ears. So that, maybe something happened in your ears. So I want to ask you more about extractions. So do you think, I know you've done extractions, do you think that when children get extractions, if it's unnecessary, this can be very destructive and very bad for the child's health in the long term?
Mostly, yeah. Mostly it's, I believe, really bad effects. But, some cases with really good tongue posture and noise breathers, I think doesn't affect much. It depends on the case, Not every case, extraction case is the same, but really, I think orthodontists should really consider give the decision thinking about airway focused. Normally, really, it's very bad. They don't know the importance of tongue posture, airway health. They can't do relation with tongue and the palate expansion. So this is really bad for bad chance a patient to be treated by like a doctor. So the family should be consider about their kids, I think.
Yeah. Yeah. Do you use double jaw surgery sometimes? You refer patients to have surgery?
Yeah, some really needs because you can't do MSE, or really they need much more lower jaw forward growth. So how you can manage it? The condyle has a space, so you can't put off its way. So surgery needs, yeah, really. Some cases.
And do you have a surgeon that you work with closely near Istanbul?
Yeah, I advise. But I prefer my patient to find their surgeon because really Istanbul there is good surgeons.
Yeah. Yeah. What do you think about mandibular distraction, like MSDO, or like do you know Dr. Yousefian in America? Have you heard of him? Dr.
No.
Joseph Yousefian.
Joseph.
He
No.
he does a procedure with MSE. He calls it DAME, distraction assisted mandibular expansion, where he cuts on the mandible and then he expands the mandible. What do you think about that?
I spoke in orthodontist in professor in Turkey. He said he has some cases with MSDO, distraction osteogenesis, and he said after it makes the appearance very wide and ugly for me, so I give up to perform it. He said it doesn't need it because Invisalign really expands the lower teeth uprighting, by the way, so not needed.
But don't you think though sometimes with MSE you get too much expansion here and then the chin stays narrow and it looks funny?
And not funny, but yeah, I have some cases like this. I manage them. Of course, it should manage with lower jaw expansion regularly and slowly to catch upper jaw. It's possible. I have cases ended and still continue.
But don't you think though, if you could have skeletal expansion of the lower jaw, even if it was only a little bit, you could avoid that, and you could also expand more with MSE if you had the ability to do skeletal expansion of mandible?
Yeah, possible. Yeah, but the patient gives this decision. I let the patient what they want. I don't persist on something. This is perfect. They can do what they want. No problem. Of course, they can search from the Google to side effects, what's happening. I only warn about the surgery. It's a procedure to cutting bone and the vessels may be risky. As numbness happens then. So no problem for me. But in some cases, I manage when upper jaw expands much more. I manage lower jaw. It's like a V shape. It is normally back, so it's when coming forward, it's coming more prominent. It really comes forward.
Right.
Most cases, yeah.
So you're saying when the lower jaw slides forward, it actually gets it's wider, and so that helps manage the asymmetry in terms of upper versus lower?
Yeah, together. But I don't prefer my patient to expand much more. It's really hard to manage for lower jaw and also the bite with orthodontics.
Yeah. Yeah, this is a big issue, how to manage the upper and lower jaw together with MSE. But basically, you do it with Invisalign?
Yeah, it's
More or
really
less.
easy way, yes.
Okay. Thank you, doctor. I want to ask you now about helping children and about what would be your advice to someone who just had a baby to help the baby grow to be beautiful and healthy?
Beautiful is about gains. I advise not obsession with beauty because every kid is unique and not should be same. But airway health is unique. It should be the same. There is some proportions you understand what's happening on the face. If you, as me, I am a mom. You really consider your kids every day. You are looking how growing, how changing. So, for example, first time when I recognized my daughter, she born with the eyes like sunken, prominent cheekbones. Yeah.
Yeah, that's good. The light is good.
Okay. For example, when I saw my kid growing, I said to my husband, no, she doesn't look like you and me. We have Arab ruined face, me and my husband too. So our gen is really different. So this child is different. But after 9 months, 1 year, she started to get gribble infection so frequently. After I recognized face coming like this, so I mean 8 years ago. So I searched on Google, what can I do? So I went to London to take education from my meal. I said my husband, we should do something for treat my kid. I should do something for my patient also and myself. So I searched, I learned how to tongue posture should be, how the face is destroys by the time mouth breathing. Of course, in dentistry and orthodontics, we know functional appliances and adenoid face. We educated about it, but in practice, really, we are so weak. I really first started my kid when she was 3 years old about Buteco method to use mount tap one time, and after she habited. But I used my brace infant. I followed her till to 5 years old, but I recognized that upper jaw never expand. Of course, face gets a bit supported with the tongue posture. She tried, she learned it, but the baby photos really different, a bit ruined still there was. So when she was 5 years old, I decided, first I tried with ELF because she's baby, so how can I manage the bite? So I try ELF to expand his, because she was deep biter, class 2. So I did some expansion from front teeth. I recognized, yeah, it's coming more, some relaxation happens for jawline, lower jaw, because lower jaw relaxed and come more forward. When she was 6 years old, I put the first expander. We did really good result then. After 2 years, approximately 1.5 year later, I put second expander. So we really get good result for her. So,
Wow.
so you asked me what did you advise for the parents, you asked me. Of course, when they should do oral posture, sleep posture. They can search on Google. It's so common now. But they all time try to keep their baby's tongue up position. I mean the baby, the infant is feeding, mommy feeding, so till to 1 year old or 2 years old, because they really need help to massage to get the correct posture by an adult.
How do you help them? You actually use your hand to close their mouth?
Yeah, it's important because when you put your finger down on the chin here, there's hyoid bone. Hyoid bone is the bone of tongue. All tongue and the lower jaw muscle is attached to it. So when you massage it, you input, your tongue, you can manage the tongue getting more up. It's easy, really easy, because baby has habit to sucking breast and anything, pacifier.
And for for a child like maybe 2 years old to 4 years old, would you, if you see that they mouth breathe a lot?
Yeah, they need expansion. Yeah.
That means they need expansion?
Don't wait, because nothing changed, I say. But if, of course, it really depends patient to patient how it's habit. I should really need to leave them for a while, day to night, to understand the habits. But mostly, I think they need really expansion, because most children, it's like pandemic, It's not an epidemic. It's so common on the world. The kids born with narrow jaws. You see the teeth, normally primary teeth should have gaps, should have gaps. But the old kids is coming mid, all the space is closed. You understand that the permanent teeth will come crowded or jaw go back.
Right. So what is the youngest age that you can give a child an expander?
I think, for example, I saw on symposiums, education, I saw some doctors applies at 2 years old, 2.5. Yes, really can manage. And my kid was 3.5. I put. I educated my kid, my daughter. I said, you need this, okay? Maybe 3 to 6 months. I all day say you need expander like this, and you can't breathe. You are snoring on the night. Even I did the perfect posture of my kid from the birth. She had really snoring on the night when she was 3 years old. So I tell him, and she said, Mommy, when you put my expander, Mommy, I want, please put, I am ready. She said me after I put 3.5
And
years
whenever
old.
you see a child mouth breathing, do you say, stop, breathe through your nose, close your mouth and breathe through your nose? You tell them verbally over and over and over again?
My kid, I leave my kid, so yeah, I do. But in my patient, I saw them for 1 hour or half on the visit, so I advised them. But I said, patient, be sure that the noise is open. If the noise obstructed, so how the kids breathe? Of course, open one.
Why do you think so many kids now are being born with small jaws and adenoid face? What's happening in pregnancy or in health in the society?
It's modern.
Tongue tie. Why are so many kids born with tongue tie?
Yeah,
now?
it's modern life. We don't ancestors. We don't look like we are changing. So we get habits, the easy life conditions. We don't need to hunting. We don't need to use our muscles, because we stay and doing our work, staying. So we don't need to breathe much, but it's really harm to us. So we get, by the time, it's not new, it's really old, because maybe you remember your friends' grandparents is snoring. They are laughing, they say, oh, my parents snoring, it's not new. Snoring is not normal, really, it's not normal. But we have stories about snoring our relatives, adult relatives. So they have really problem with their lifestyles.
Yes.
It's very hard to change. Sometimes I manage my kids to find something like playing to make them run faster on the ground or garden. I say, I give them some aims, run here 5 times, or I will give you this, and no, because they don't really need to run. Why they run? There isn't any life conditions to, of course, playing on the park, good in the sun outside, but when it's winter, they should be stay at home, because outside is cold. It's, yeah.
Life is very unnatural.
Yeah, yes.
I'm sorry, did you want to finish that thought? I interrupted you. No, don't worry. So, I know that you're Turkish, and I know from your Instagram page you're Muslim. I read that in Islam, they consider breastfeeding to be not the choice of the woman or the mother, but the right of the child. Can you speak on this? Do you think, how important is breastfeeding for development of an infant child?
This is nature. There is nothing to think about it much. Before, as a doctor, before they said not feeding important before, for example, 20 years ago. But now it's, of course, important. This is not only for human being, animals the same. Breastfeeding. Yeah, it's important. But I am not rigid about breastfeeding, because really in this modern life, some mother has really big stress on their body, so they don't have milk. So what can they? But I advise them to use pacifier. It's very good. Or the other doctor, attachment parents, they advise using some pipes and touching the breast of mom and feel the heat of the body and feeding directly from. Yeah, there should be options. But I don't think every child with didn't breastfeeding from mother. For example, my cousins, my uncle, daughter and the son never breastfeed, but they show not really bad. It's tongue posture, breastfeeding, and body posture, moving, correct development of the posture is moving every time.
Do you think that the role of breastfeeding is just to teach tongue posture? So if you can, if you can learn tongue posture without being breastfed, it's still okay. Is that what you're saying?
They born with tongue sucking, because there is evidence we know in the ultrasonography. We saw kids doing tongue sucking or tongue. We can see that, and when they born, they do like this sucking when they're newborn. So it's inside coming, not teaching.
Right. In Turkey, is there most women breastfeeding, or is it becoming more like the United States where women don't want to breastfeed?
United States women don't want.
Generally, it's uncommon, I think, for there to be extended breastfeeding. Maybe a few months women will breastfeed, but not more. It's very rare for me to hear of someone breastfeeding, for example, for 1 year or more.
Yeah, it's now it's global problem, not about, but the traditions, yes, maybe Turkey is more tradition, breastfeeding important, but every mother has sensitive. If they look search about the health, they can reach the perfect information. So there should be statistic about this. So I don't know recently what's now, but of course, every woman around my friends and my environment, they really consider breastfeeding much. For example, my sister-in-law, she did Tandem, together, tried breastfeeding. Some of my friends did Tandem together.
What do you mean by tandem? What's tandem?
The bigger was 2 years old, the newborn, same, breastfeed the same time. Yeah.
You mean like one on each side?
No, not the same time. Maybe finish one after.
Okay.
Or the same, no problem. If their age is
Okay.
similar. Yeah.
Right. Well, in the old days, there used to be wet nurse where my mother said, my mother grew up in Lebanon, and she said when she was a baby, my grandmother would breastfeed her and her siblings, and then she would also breastfeed some other kids from other parents, and the woman would share the children.
Yeah, I did also. I did my sister-in-law's, my husband's nephew. Yeah, now he's my son too. Yeah, it's good.
Right.
No problem.
So in the old days, and maybe in Turkey and some other places, women have options if they can't breastfeed themselves because maybe they have no milk or maybe they have job. They have options for how the baby can still get breastfed. But in America, we don't really have that cultural support. So it's either breastfeeding from mother or bottle. So what do you think is the best thing for a woman to do for her child's face and airway if she can't breastfeed?
Don't forget, the baby habitual is do the correct tongue posture. Okay? The problem is when they forget to noise breathing, the reason is the infections, thickness of nothing. When the noise obstructed with mucus, they should rinse it. They should be sure it's open, okay? And encourage their babies to breathe through noise. They should do. But I believe that some kids really born with the narrow jaw, so even they keep noise open, they really snoring till they are small infant months age, okay? They are snoring even they close mouth, struggling. So really there is kids like babies like this. So there is not much to do. They really need expansion.
Right, they need expansion. Wow, at such a young age, I don't think anyone would think about expanding such a small child, but maybe that's what's necessary.
Yeah, it's pandemic,
Would you tape the mouth of a baby to help them close their mouth when they sleep, or is that a bad idea?
Bad idea, because they should recognize what's happening, because it's horrible otherwise.
Right.
Yeah. And what do you feed a baby when they stop drinking milk? Like when they're 1.5 and they start wanting real food, what do you feed them?
Baby weaning, you mean?
Yeah,
encourage them using their hand and bite the carrots or feel the thickness and softness of the foods, experience with your hand and use after spoon, maybe after that. But giving broccoli, carrot, the other vegetables. Yeah.
Not puree.
No, it's not good idea. Yeah. But
It's
so yeah. But you should follow the kid because obstruction for the airway is risky. So you don't leave the kid, a baby, small age, even if bigger, there is a risk. But I know that the babies are mirror of the parents, which they live together, which they sit on the dinner or breakfast table together. They all search observation they do, looking around how they chew. So first, parents should correct themselves. I have a very strange experience with my patient. I want to tell you.
Please.
Approximately 10 years ago, maybe not much, 8 years ago, I treated a family. There's 2 sibling sisters, okay? They had sibling sisters, but they have 2 child, okay? Big sisters are big, so they bring their kids to me. First, they bring one has daughter, one has son. They are 16 years old. So they were class 3 and crowded teeth, so I fixed them. Okay, finished. After 1 year later, they bring their smaller kids. One was girl, one was boy, but the same age, 9 years old. But they were class 3. But mother is class 1. The big siblings together, class 2 and crowded teeth. But the smallest are like this, class 3. So it was very strange. I asked your husband's family, there is class 3. They said no. So by the time I give expansion and face mask them, I treated them. After one time, their grandmother, the mother of big siblings, came from Bulgaria. She was Bulgarian. And they said, I looked my granddaughter and grandson together because my girls was working outside. I make them grow up when they were newborn to go to primary school. And the grandmother was class 3. You know? So
Yes.
strange.
Wow.
So yeah.
So what's the lesson?
The grandmother looked after the smallest kids together. So they all time saw their grandmother like this, early morning to evening, because their mother outside, they don't see mother, father, they live grandmother together. They are all habitual class 3, habitual.
Wow. Wow.
So you're saying children will copy mother and father. They copy the adults.
Yeah, if they really feel, attachment, because really she was a good human being, and really take care of the grandparents, so they feed them early age, and the kids love her, all mirror all the postural habit, class 3.
Yes. That's incredible. That's incredible. And it just goes to show how important it is to be a good role model for a child in everything, not just in your body, but also in your behavior, how you treat other people, how you do anything, smoke, drink, what you eat. The children will copy you.
Yeah, exactly.
That's an incredible story. Wow. Doctor, yeah. We're at the end now. I would love to keep talking to you for many more hours.
Yeah, me
You're so full
too.
of wisdom.
I don't understand how to time pass. Thank
We'll
you.
have to do it again. You've given so much great advice for adults and for parents about children. I think you really are a top expert in the world in this subject matter. And are you taking international patients? Like if someone wants to travel from Europe or Asia to see you, no problem?
Yeah, they approximately 4 years ago they started to reach me from the orthotropics map. Yeah, I had a lot of patient international. So I removed my clinic to another city, Istanbul. Before I was Bursa city in Turkey. Now I am in Istanbul. It's more metropole. God, I have so much international patient now. I'm happy for this. Yeah, it's good career for me to experience more patient all around the world concern the same thing, selected cases for airway issue, because I haven't given forces to teach parents they uneducated about airway. They don't understand what I say because it takes my time much. But now the educated patients really coming and they know what they want. So I'm very happy to treat them.
That's remarkable. I think that's incredible that you actually like the patients who have done study and who understand the theory, because then you don't have to explain and convince anyone.
Yes, I am so lucky for this. Yeah, I am really appreciate for my patients. Yeah.
You know, doctor, that's rare because I've had other doctors that I spoke with after they came on my channel. They were unhappy because the patients that came to see them, the adults who wanted to change, they didn't like it because it was too difficult. Those patients they thought were too hard to treat. And so they actually asked me to stop sending patients. So you're special, and I think you're exactly what someone should look for, which is someone who enjoys the challenge and the difficulty of taking an adult with airway issues and helping them. It's not easy, and it's not going to make you rich because it's so slow.
Yeah. Yeah,
But-
and also
but
I don't
it's so
say
important.
but I don't say I really change your life. I do this. I only I am like a mentor, okay, managing how for example, sometimes they came to me big expectations, so I decreases it. If don't want surgery, orthotropics and this situation applies only change like this. Imagine change will be little or maybe much, but you should understand what these applies do. You know, sometimes really they come big expectations. So I said you should go surgery.
Mm-hmm. Mm-hmm. Yeah. I think that's so wise. And that's one thing I try to do as well when I speak to people, is set expectations about what can and can't be done with different types of treatment, whether it's be the limits of tooth-borne expanders
or whether
Yeah.
it be the limit of MSE, and then sometimes you just need to go for surgery if you want to really get that major result.
Yes, exactly like this. Yeah.
Yes. So thank you so much for your time, and I wish you a good evening, and I hope we can talk again soon.
Yeah, good. Nice to meet you. Really. Okay.
Thank you, doctor.
See you. Good evening.
Thank you so much.
Bye bye.